Welcome to another session of iLive. My name is Janai Graham. I go to Bergen Arts and Science Charter High School. I am a senior. My favorite subject is art, and I've committed to Montclair State University under the major of graphic design.
Hello, everybody. My name is David. I'm also a senior and also attend Bergen Arts and Science Charter School, like Janai. My favorite subject is science, and I'm currently going to go to BCC. Currently going in undecided, but greatly considering going to the nursing program.
Honestly, David, whatever you do, I'm sure you're going to exceed at it.
You too, Janai. You're a legend at art. Love all your masterpieces.
Thank you. Thank you so much. So, David, how has remote learning been for you?
Remote learning has been pretty chill for the most part. I have to say it's very nice that we can just have our Zoom classes while we're on our bed. It's very comfortable, you know?
I have to agree. There's just something really special about being around something that you know, something you're familiar with, and be comfortable. And also, another thing is you don't have to wake up as early. Because I
Yes.
don't know, but yeah. Go
I
ahead.
will have to admit, I do sometimes wake up on the dot for class. It's not the best, but it happens sometimes.
Yeah, I used to have to wake up around 6 in the morning, but now I can wake up a whole hour and a half later, which definitely matters during school. I mean, I feel like a bit more energized, but I also feel like I'm making my own choices, you know?
Exactly. But, soon we're going to have to go back to school and we're going to have to start fixing our sleep cycles. So let's all get on it sooner rather than later.
Yeah, but there definitely are some pros to going into school. Like for example, our favorite subjects. Like I like art and then sometimes that could be a more hands-on project. And you like science and there's just some labs that you can't do at home. You also further mentioned that you want to go into the medical field in the future, which is really interesting because that relates to today's subject for the broadcast. So, there are and have been many exciting innovations, especially during the pandemic. There's a lot that we don't know about and that we should be learning about, especially because of the times and also in case we want to go to like a medical field in the future. So that is why we invited Dr. Brenner here today. And by the way, anyone who is watching today, please feel free to ask any questions and put it in the comment section.
Yes. And before we begin, let us give you a little background on Dr. Brenner.
Yes. So, Dr. Robert Brenner is the President of Clinical Integration and Physician Enterprise for Valley Health System. He oversees quality and performance improvement, strategic relations, and clinical service line development across VHS, as well as Valley Medical Corp, Valley Home Care, Caligo Care, and Population Health. Dr. Brenner joined Valley in 2015 as Senior Vice President and Chief Physician Executive for VHS and has led organizational transformation from fee-for-service to fee-for-value that included the conversion to shared savings contracts and the development of Caligo Care and VHS's Population Health Department. Dr. Brenner led the creation of service lines spanning the continuum of care, the reorganization of transitions in care and case management, and the unification of quality management across VHS.
Very impressive. Dr. Brenner is also a speaker on various healthcare topics at national conferences and has been interviewed by local, state, and national news outlets. He has spent 6 years on the American Medical Group Association Foundation Board, working to empower its 450 member organizations to improve healthcare for 1 in 3 Americans through its many programs. After leading the development of the foundation's strategic plan, Dr. Brenner was appointed its chairman of the board. He received his medical degree from the University of Pittsburgh School of Medicine and completed the Columbia College of Physicians and Surgeons Overlook Hospital Family Medicine Internship and Residency Program. He also holds a master's degree in medicine management from the Carnegie Mellon University Heinz School of Public Policy and Management and completed a strategic leadership program at NYU's Stern School of Businesses.
Yes, so without further ado, let's welcome Dr. Brenner.
Hello, everybody.
Hello, Doctor.
Hello.
Thank you for inviting me on iLive. This is really exciting. And Janai and David, it's really nice to meet you. And I did want to say, let's spend more time talking about the subjects at hand rather than my background. But so you can ask me what you need to ask me about some of what's going on in healthcare.
Of course, we're glad to have you
Certainly.
today. So, David, why don't you start us off with the questions then?
Very well. So, Doctor, it is no secret the pandemic has affected the lives of many people, but specifically those in the medical field. So, Doctor, how has the pandemic affected your life and your job specifically?
So, I'd like to talk about how it affected healthcare workers in general, because I'm in a more administrative position, and it's definitely affected me. But it really, really affected those people that were working, every day with COVID patients through this pandemic. It's been very, very tough. If you think about it, at Valley Health System, just the story is it's almost like, and I keep saying this, it's like a storm rolled in from the east, and all of a sudden, we went from one patient on March 13th to on April 5th, only like 3 weeks later, or less than 3 weeks, we had 240 patients.
Wow.
In that time period, so much happened that we had to adjust to. We had to create negative pressure rooms. We had to bring in staff that weren't used to working in the hospital, but from the practices. We closed practices, we closed surgeries. It was a massive undertaking. But when you get down to the individual person, each of those people were watching people really struggle and go through a very, very tough time with COVID. And many people died that came into the hospitals, and all the hospitals across the country. So it was something that many of us have not experienced in our career, and it required quite a bit of resilience.
Yes, definitely. This is something that people have said. This is like making history, but not in a very good way.
Yeah, it's something nobody could have prepared for.
Yeah, I think you're right, David. We really couldn't prepare for that. Well, now we can, because we know that pandemics do occur. I mean, most of us didn't know about anything other than the history in 1917 and 18 when the flu pandemic came. So we weren't stocked up to that extent. We didn't know how to, mobilize staff. All of that, as you mentioned about innovation, that required innovation. How do you mobilize staff? How do you teach them to do the things they need to do to care for the patients that are in the hospital? So, it was quite an experience. And I know that you said it was a negative experience, but there were some positives in it. Um, Positives in some of the impacts that we had on patients and families, some of the teamwork and bringing together of people, some realization that we could be much more nimble and innovative than you would have ever thought. So there was silver linings. Never want to go through this again, believe me.
Yeah.
And I would say everybody in our hospital would say the same thing. But um, people do recognize some of the positives that came out of it.
Yes, I have to agree. Despite the shortcomings of this tough year that's hit so many people, there have still been those who are working to save people and working on ways in improving the medical industry.
That is very true. And with that being said, Janai and I are very interested in some of the medical innovations that you've mentioned. So, Doctor, can you please elaborate and enlighten us on some of these medical innovations?
So the innovations are many. You've heard the phrase that necessity is the mother of invention. Well, when you need to do something, that's when you're forced to come up with solutions. And what we saw, and I want to say something about innovation, is that you have to have certain principles that allow you to be innovative. You can't fear failure, because you're dealing with information you don't know about. We didn't know about this pandemic. We didn't know about this virus. We didn't know whether it's negative pressure that we need to do, or what medicine. We all thought that you've heard probably Plaquenil was the medicine of choice. Was that really? So we had a lot of unknowns. So you have to not fear failure. We realized you have to be flexible. You have to defer to those people that have the knowledge. So, for instance, in our organization, there was an infectious disease nurse who kept up with all of what was going on from the CDC, and we deferred to her. So it wasn't like the doctor knew everything. We deferred to this woman for most of what went on in our decision making in terms of CDC guidelines. Um, the other thing is you have to share information. So we had health systems. I personally spoke to Wuhan, China, and what was going on there. We spoke to California, which was a couple of weeks ahead of us on this whole thing. We spoke to health systems around New Jersey. What are you seeing? Well, we're seeing a rise in COVID. What are you doing with this? How are you managing ventilators? Speak of innovation, we had an anesthesiologist go out and go to Home Depot and buy PVC piping to put it together to figure out how we could run one ventilator and two patients. And that's innovative. And the reason was we were running out of ventilators. So then where do we get ventilators? Do we buy them from China? Do we buy them from here? All of these different things. There's different types of innovation. It's not just technology. I mean, telemedicine was one of the innovative tools that we all used to start to see our patients that were home and needed help, medical care. So there was so much. One of the other innovations that's interesting is that then we drilled holes in the walls, our facilities people, so that we could put the IV tubing in so that when a nurse had to adjust it, all of the bags, the IV bags, were outside the room so that they didn't have to get additional exposure. So
Wow.
these are simple things, a hole in the wall, but it managed to keep our nurses safer. So there was a lot that went on.
Wow, that's very clever. Just a simple hole in the wall could actually help save someone's life, minimize the exposure. That's very clever.
Yeah.
Wow.
I have to agree. So I heard you mention something about the infectious disease doctor. Is it called doctor or
Well, we had an
specialist?
infectious disease nurse, and we
Yes.
have an infectious disease. Our Dr. Fauci is an infectious disease physician who helped us every day. We had to, and communication is another big part of innovation and managing through a crisis. We had meetings with all the physician leaders. We had meetings with all the nurse leaders. We had a daily safety briefing every day. How's it going in the units? How's it going on our supplies? How are we doing, with food? How are we doing with gowns? All of the masks, all of these different things that we went through. It's called a daily safety briefing. So, but we had a lot of people, everybody pulled together to make this happen. And so I think, first of all, we all got to know each other a little bit better. We all realized that teamwork is the way to go. And we all say, oh, well, teamwork is what does it. But, without that, we would never have survived. Never.
Wow.
Yeah. So would you say that certain jobs, such as the infectious disease director, do you think that those jobs have risen or become more important during the pandemic?
Absolutely. Certain things that you wouldn't think of became more important. And you know what the other thing is? That there were people in jobs that they had prior to COVID, and then they changed their roles during COVID. So we had, let's say, office staff that decided to pitch in and volunteer and help with COVID patients. And you heard of proning, where you take the patient and you put them on their belly, and that helps their lungs aerate better. So how do you do that with a person who's on a ventilator who's, not always fully conscious? And so we had teams of people running around, and those people were doing things that were completely out of their comfort zone.
Wow.
So, it was, unique. You'd see somebody who was a registrar in an office, helping on something like that and taking their own lives in their hands to do this.
I admire the initiative they took. That was very brave of them to actually help out very physically with this.
Yeah. And there were some
Wow.
people that were very frightened and, were afraid to be around a patient who had COVID. It was a scary time. I mean, and a lot of people, if you think about it, if you're a healthcare worker, and what happens if your family gets it? And what if you bring it home? Or what if they have it and you don't have it? Some
Yeah.
people stayed in hotels away from their family because they didn't want to give it to them. So go ahead, Janai.
Oh, I'm sorry. I was just saying that's very sad. And honestly, I do have a lot of people in my family who work in the healthcare industry. For example, I have a cousin named Ashley, and she actually did get COVID, but she personally didn't show as much symptoms. And she was so worried about passing it on to her two kids that she didn't even want to quarantine, like at home with them. So she tried to find other avenues, ways to stay away from her own family, and but she has a younger one, so she needs someone to watch her and go to school. So there's so many different aspects of situations that people don't actually consider.
Right. That's right. And then you had also just the workload. There were certain people that were working 7 days a week for a while. We actually gave them resilient time. We said, look, take this time, go home and regenerate, because if not, you're not going to be able to do your job effectively. It was tiresome. There was nonstop, and we're still dealing with COVID right now. Although if you look at the curve, it went way up in the beginning, and then it kind of came down, and now we had a little bit of a resurgence, and then that's been smoldering along for a little bit. So we're not completely out of the woods yet.
I see. When you mentioned that some people were actually getting very tired of this, I do remember seeing on social media that a lot of nurses were actually complaining and actually crying because they actually had to quit their job because the stress code was putting on them. So
Yeah.
that is a very heartbreaking thing to see.
Yeah. Thankfully, we didn't have many of those circumstances. We were very conscious about people's stamina, their mental health, how to support each other. We actually had resilience rooms where people would go and be able to just sit and take a deep breath, and whether they meditated or just closed their eyes and relaxed for a couple of minutes. So we were very attentive to that. We had a whole program, a resilience program, throughout the hospital, where certain people, all their job was is to go around and make sure everybody's doing okay, and if they weren't, try to help them through it. So it was a challenging time, just really something very unusual that
Wow.
people go through. And I don't think too many people have gone through this in their healthcare careers.
Indeed, it was very unprecedented, but it's glad to see that people were looking out for each other. You said teamwork was a big part of going through this, and luckily we've seen it in action.
Yep.
Yes, I have to agree. Okay, I have another question. This is really interesting though, because some people, like you said, like people can't go to the hospital and see what's actually happening behind the scenes. You also mentioned that you have these rooms that people can sit in, and I've also heard that there are kind of similar rooms, but not for healthcare. Do you think that the rooms that are in healthcare are something that should stay consistent?
Yeah, I think that that's something we should continue. There's a lot of things in that we learned in COVID that are going to continue on for the future. Telemedicine being one of them. These rooms, resilience rooms, and our resilience program should be, continued. It may not have to be at the same level, because the stress level is not as great. But there are a lot of things we learned that we are going to continue. One of the things is the virtual interface. A lot more could be done virtually, and I don't think that we should be completely virtual in the future, but we do have those tools at our disposal to use when for instance, I would travel from office to office. I wasted a lot of time. Now I just get on, or I could even call somebody on Teams or Zoom and say, "Hey, do you have a minute?" So,
Wow.
Yeah,
and then actually see them. So that has helped for sure.
Wow.
definitely.
So I have also like a bit of experience with this, not like because I'm not a doctor or anything, but because I have an issue with my thyroid, I actually had to use like virtual meetings to talk with my endocrinologist.
Chronologist, yes.
Yes, and it was much better because, again, we could avoid this type of contact type of thing. And I would like to say that it's very efficient. So I'm very happy that this was a new way that we could actually find and contact and actually just keep up with like the progress and such things.
Right. Yeah, David, that's a good example because a lot of patients. So if you talk about telehealth, during the pandemic, people didn't want to come in. I mean, no one wanted to come in, and in fact, we had our offices closed, and we were just using telehealth. But and so 90 some odd percent of all of our visits throughout the health system were telehealth. And now we're down to about, in primary care, about 30%, and overall about 15% of our visits. People still want to see their provider and their physician and their nurse practitioner, but And sometimes you have to be present to examine a patient. But there are many instances where it's really just following up with a thyroid and reviewing your blood work and so forth, where it's a perfect use case for that, where we use telehealth.
Oh, it's very interesting. Were there any such cases, like specifically that telehealth wouldn't be as helpful in? Like, what type of people, what type of conditions would they have to be so that telehealth wouldn't be as helpful for them?
So, I mean, certainly anything that's urgent, or certainly something that requires a physical exam, so that, we could run through a whole bunch of things. I mean, your routine annual physical is not going to be done easily on telehealth.
That's true.
But let's say things like a urinary tract infection, review of labs, looking at a dermatologic lesion, behavioral health, such as, counseling online, is very amenable to telehealth. And genetic counseling, these are the things that we see easy uses for.
Oh, well, that's very nice.
Like, I forgot what it was, but I think I did research before this broadcast, and I saw that some companies, like medical companies, were joining with other companies, but instead of doing telehealth things, they're doing things like transportation. Like, for example, they're dropping off medical things at people's houses instead of them having to worry about ordering them or contacting their pharmacist and not being able to drop things off. Do you think that like joining with the other companies, is that going to stay consistent as well?
Yeah, I think, Janai, you bring up a really interesting point, because in the healthcare industry, we've seen a big move into the home. And so you see a big movement on hospital at home, where certain patients could be at home. Let's say they have pneumonia, a mild pneumonia, and there are companies that are doing hospital at home. There are certain companies that are doing home visits. And so there are now a whole slew of companies that do home monitoring, and they're using artificial intelligence to do that. So there's a company that I've been interviewing a couple of them, because I'm very intrigued on how to deploy that for our patients. But there are companies, for instance, that will have a connection to the TV. And so you wake up in the morning, and just like Alexa, you say, good morning. And then the voice comes on and says, hello, Dr. Brenner. Did you take all your medicines? Which ones didn't you take? And then if you checked your sugar and you happen to be diabetic, it'll say, well, that's a little high. Do you mind if I, send this over to your physician? And it's sort of automated in a way that is unique. So there's a lot of uses for things like this, and a lot of development going on in industry. There's also a lot of companies that have come in and develop things to help us with the vaccines and monitor that. There's a whole slew of telemedicine companies that have come up. In fact, there's a medical practice now that's only telemedicine. There are many of those that have cropped up. So yeah, this has really changed our perspective on things. And I predict that in the next decade, you'll see a lot more going into the house, into the
Oh,
home.
nice. More convenience, the better. You've mentioned the vaccine, and that is a very hot topic. It's like ever since it ever came out. So it is no secret that the vaccine usually takes a while for it to actually come out. Yeah, we know, with all the trials and testing like that. But the coronavirus vaccine actually came out in like record time. So would you say that the methods that we implemented for the corona vaccine would be used on for later vaccines in the future, considering the speed and whatnot?
Yes. So I am reading a book that I want to mention. It's called Codebreaker, and it's about the woman in Berkeley, in Berkeley University, that has developed CRISPR and the technique of gene modification.
Mhm.
And a lot of it was applied during the development of the vaccine. So the vaccine was using a technology that was invented and used to try to come up with vaccines for cancer. A couple of them were under study, but it's never been used for a vaccine for a virus. And the mRNA technique, I don't know if you're aware of it, but I could just briefly tell you that really what it is, from biology, I'm sure you learned about RNA.
Yes, central dogma.
Mm-hmm.
And the RNA, what it does is that this vaccine uh, it sends in the messenger RNA. It goes into your cell, and then after going into your cell, it directs your DNA to develop a protein that's the spike protein. You all seen the corona spikes, and
Mm-hmm.
that protein, if you develop antibodies to, you will kill off the virus. That will be your approach to it. So that's what they did in the Pfizer and the Moderna vaccines. And I am amazed at what they did. So that's why I'm reading that book. It's just so interesting to use this different technology. And within months, they were able to code for the spike protein and develop an effective. I mean, these vaccines are upwards of 94, 95% effective. And even if you get exposure in the 1 in 20, people will get the virus. It's a very lessened case, and so it's very minimal. It could be from a cold to the flu, and 100% of the time you will not go in. There's been no cases where they've required hospitalization or died. So far, so the vaccine is very effective, and to me. Um, One of my challenges right now is not only delivering the vaccine, but it's also getting that 30% of the population that we have and others that really have a hesitancy about it and don't know a lot about the vaccine. And it tends to be in certain subgroups who are less trusting, and understandably so. So it's an educational it's an exercise in education and really understanding why a person fears taking the vaccine. And
Wow.
sometimes you can help. I could give you just one anecdotal story. There's a woman that works on the cleaning service in our facilities in the area where my office is. And I, was all charged up. We got the vaccine. I said, "Are you going to get the vaccine?" Because we're giving it to all the healthcare employees. And she said, "Oh no, I'm not taking that." And I said, "Tell me why." She goes, "I don't know. I mean, it's going to cause me to get sick and this and that." I talked about it with her for a while. Well, I went back into the vaccine clinic and I saw her sitting there in line
Oh,
and she got it. And then I actually today saw her in the hallway and I said, "How you doing?" She goes, "Oh, that was nothing. I'm so happy I did it." So there are a lot of stories like that. So we can turn people's minds if we help educate them and answer their questions.
I like the fact that they can be educated, helping saving more lives. It's very nice.
Yes. Speaking of education, I know we're going back a little bit, but David actually mentioned that he wants to go into the medical field. And I know that because of the pandemic, teaching people how to do certain surgeries, do certain medical techniques has been very difficult because you have to do social distancing. So I've heard that there's been virtual reality training actually. So what do you think of that, and what could be the benefits of doing virtual reality rather than hands-on?
Right. So, well, you're speaking to somebody who has a son who's in medical school.
Oh,
And I feel really bad for him because actually, what's hard is that he's home and doing everything virtually. They actually even closed. He's a first year. They closed the anatomy lab because a couple of people got COVID in his class, and I feel like he's missing out. There's a lot of the networking that goes on and the hands-on experience that I think you need to have in your medical training. But here's what I believe. I believe with the vaccines and taking the necessary precautions with mask wearing and hand washing and so forth, we'll get back to that. And I think within the next year. So, David, you're you mentioned you're going to go to Bergen Community College and think about nursing. Well, by the time you get into clinical and there's a need to be in front of a patient, I think you'll be able to.
oh,
I'm hopeful about it. Yes.
I'm looking forward to it.
Yes. Um, okay, so another experience that I've went through actually, I believe it was in eighth grade. My teacher who taught us computers actually had a 3D printing machine. Now, she showed us some videos on how they use 3D printing in the medical field, which I think is really interesting because, in general, a 3D printer, just the concept is going from 2D to 3D is just so interesting. So, how do you think that 3D printing can help in the medical field?
So there's a lot of things that 3D printing is being used for. We used it during COVID. Now the masks, I don't know if you heard of the K95 mask, not the
Yeah, sure.
N95. And the K95 was used mostly in construction and to filter out, particles. But it didn't fit the same. It didn't have the same fit as the N95 for many people. So it came in one size, and it wasn't really meeting standards. So one of our cardiologists who has a 3D printer, who was using the 3D printer to really look at some of the things that he was working on in a person's heart. He would actually replicate it off of an X-ray. So then he said, "Well, I'll tell you what. And here's an example of innovation. I'll use this to engineer and make a plastic device that goes on the back of the mask that pulls it tighter and makes it fit to meet the standards, what we call a fit test, as such as an N95, because we were running out of masks." So we were using the K95, and then we used this device to help us. So what is the application of 3D printing? I think there's many. There are people that are using 3D printers, let's say, to develop a tissue, let's say somebody's ear, and then over that they have cells grow. So they have the cartilage underneath it would be plastic instead of cartilage. And then they have, ear tissue grow over it. They're using that for valves and all kinds of other heart valves and all kinds of other things. 3D printer is definitely being used in a lot of different ways.
Interesting.
You have other questions, guys?
I'm very interested with the 3D printing because you mentioned that it's helped build tissues. I don't remember how exactly, but I do remember reading some kind of thing about that it was being looked into making organs or something like that, which I
Yes.
think was just me mistaking it for tissues, I think.
No, I think you're right, David. It is being experimented with organs. I'm not an expert on 3D printing, but I just, have read a couple of things about it or seen it on TV as well.
Wow. It is very interesting how all these innovations are just coming together, and especially at such
Yeah.
a dark time like this. But nonetheless, still very interesting.
Yeah, I think one of the biggest, if you think about medical science, one of the biggest innovations is actually the gene. Understanding the genes, mapping the genes, and then actually looking at different diseases and editing some of those diseases out. So that's one of the things. But we're off the topic of COVID. Do you have other questions about vaccines?
I do have,
Oh,
wait, can
yeah,
I
go
go?
ahead, David. I can go
Go ahead,
after.
David.
So I've seen on social media how like some people actually like when they go into like a gene class in college when they're learning about the genomes and stuff like that, they have to go through like papers of just the ATCGs and stuff like that. And is that the same thing how you would have to like read the viruses like RNA or DNA or genetic
Well,
code?
well, I think that each protein in our bodies is described by is coded by DNA and then manufactured by RNA. So RNA produces the protein that is used somewhere in that cell or in your body, and it defines it. So it could be used in vaccines to engineer different proteins. It could be used in medications. It could be used in a whole host of ways. I think, we look at the revolution. We could say information age was bits, and that was a huge revolution. The next revolution to me is actually in the gene and genomics.
Okay. My question is actually about distribution. So I know that personally, my teachers have actually been absent today, and they have shared that they're actually taking the vaccine. So, is there anything you have to share about that?
So the distribution, well, that's a broad term in terms of the vaccine because one, for us to administer the vaccine, we have to receive it. And the whole supply chain from the manufacturer down to the government and then to us at a hospital level has been very complicated and inconsistent. You've heard about that on the news where, you expect a certain number, and how do you schedule, thousands of patients if you don't have the vaccine? And then what if it doesn't show up? Then you have to cancel thousands of patients. So we're not scheduling people that unless we have the vaccine. But so the distribution of the vaccine, first, it was really limited to healthcare workers. And then after healthcare workers came those that were 65 and over. And we tried to concentrate on the 75 and over. And then came the 16 to 64 who had underlying health conditions. And now it's all of those plus teachers and different people that have delivery services and all of those different things. So by May, our president tells us that there'll be enough supply where we open it up to everybody. So if you're over 16 or 18, depending upon the vaccine, that you could come in and get your vaccine.
Oh, nice.
And
Yeah.
I can't wait for that, because discriminating, through all the scheduling and all the technical aspects of, validating somebody's a teacher or somebody's this or that, it's difficult and it's really uncomfortable. What we'd like to do is anybody wants it, offer it. And I think there'll be a time very soon where we have enough supply where we don't have to worry about that.
Yes, I hope that too. I mean, it's very difficult to, like you say, discriminate between who gets this, and you have to choose between people, because I know that there's been controversy in hospitals that people are choosing to treat some people with certain conditions rather than treat others. Is
That's
that
right.
information true?
So yes, it is. And where do you draw the line? Do you have severe heart disease? Well, yes, I do. I had a valve replacement. I had a little chest pain. You don't want to be in that predicament where you have to sit there as people come in the line. So actually, we've done the best we can as a health system to discern who comes in for the virus. We're trying to get in the people like pregnant women after their first trimester, those that are over 65, teachers. This week we had, and the reason I said I was interviewed on the news was because we had dedicated this entire week to immunizing 700 teachers a day. We will have 5,000 teachers immunized by the end of Saturday. And we've done over 50,000 vaccines at this point in time.
Oh,
So we have a massive operation that's going on, and we have all of our healthcare workers want to work at the vaccine center, because it's kind of a healing of what went on. It's now here's the answer to how we all get better, and how we're all protected.
It is our hope now.
Yeah.
Very nice.
yes. So, thank you, Dr. Brenner, for coming here today. But unfortunately, we are out of time.
Yes. Thank you so much, Dr. Brenner. We enjoy this insight that you offered us. Information was very helpful. And thank you to everybody else who came. You in the comments. We are glad that you were here with us.
Oh, I was glad to be on I Live TV. I Live TV,
Of
sorry.
Live, yes.
And meeting Janai and David. It's been a pleasure. And thank you for the time that you've allowed me. Anytime I'll come back.
Thank
All
you
right.
again.
Thank you so much.
Yes. And for everyone who is watching, make sure to subscribe to our school's channels. And thank you so much for being here with us. Bye, everyone.
See you next episode.